Hello everyone and welcome back to MediNotes for Medicos. The topic that we're going to deal today is granuloma from pathology. This is also known as granulomatous inflammation. The objectives we are going to deal today is about the introduction, the classification, foreign body granulomas, immune granulomas, gross, and the histology. So what is actually granulomatous inflammation? It is a form of chronic inflammation that is characterized by the collection of activated macrophages, often T lymphocytes, and sometimes is associated with necrosis. It's also known as caseous necrosis. The reason would be told as we go further into the topic. So there are basically two types of granuloma. One is foreign body granuloma and the second is the immune granuloma. Now foreign body granuloma are inflammation that is caused by foreign body entrance that does not hinder the T cell mediated immune system, whereas immune granuloma is an inflammatory response that is caused by any foreign bodies that cause a hindrance to the T cell mediated immune system. So what is foreign body granulomas? As I said, it is initiated by inert foreign bodies, and this occurs in the absence of T cell mediated immune receptors. How is this? The epithelioid cells and the giant cells are opposed to the surface of the foreign body, and the foreign body can be identified in the center of the granuloma with giant cells. When it is viewed under the polarized light, it appears as refractile. What is immune granulomas? They're caused by varieties of agents capable of inducing a persistent T cell mediated immune response. This is very hard to this occurs in places where it is hard to eradicate the inciting agents, for example persistent microbes. This activates the Th1 cells which produces the cytokines, for example IFN gamma. This cytokines activates the macrophages. In some parasitic inflammation, for example schistosomiasis, the granulomas are associated with this is Th2 responses and eosinophils. So this is an uh, image of immune granuloma. Next is the gross. How would we identify it? It appears as granular cheesy appearance. This appearance is the reason why it is known as a caseous necrosis. Now the necrotic material, it appears to be amorphous, like you see in the image over here. It appears as amorphous, structureless, eosinophilic, granular debris with complete loss of cellular debris. An example of this is seen during tuberculosis. The next is the histology. When we see it under H&E stain, we can see activated macrophages in the granulomas have pink granular cytoplasm with indistinct cell boundaries. This is indistinct cell boundaries over here can be seen over here. This is known as the amorphous eosinophilic granular debris. And we can see over here the epithelioid cells. This is known as epithelioid cells because it resembles epithelia. Then we can see that surrounding this epithelioid cells, aggregation of this epithelioid cells are surrounded by the collar of lymphocytes. These are the collar of the or the clusters of the lymphocytes. In some cases, during when the older granuloma may have rim of fibroblast and connective tissues. We can also see multinucleated giant cells, also known as Langerhans giant cells, that is 40 to 50 micrometer in diameter. It would have large mass of cytoplasm and many nuclei, and it has the central zone of necrosis. While we see over here, you might see a purplish distinct portion over here. This is known as the uh, Langerhans giant cells. Another thing of caseous necrosis is the Langerhans giant cells is the identification point of this sort of slides.